So I will start by sharing my presentation and please. So first of all, I'd like to thank you very much for inviting WHO to participate in this regional symposium today. And I'd like to wish you all a good afternoon, I believe it is in Cairo. I think you're 1 hour ahead of me here in Geneva. So I am going to talk to you about WHO's efforts towards improving social connections, including among older people. We started by focusing only among older people. Now we've, as I'll explain, extended it to all age groups. I'll give you a brief history of WHO's work on this topic to begin with, just to put it in context. Till 2021, WHO had done very little on this issue of social connection, social isolation, and loneliness. And just point here, social connection is kind of the overarching concept, and social isolation and loneliness are two forms of social disconnection or deficits in social connection. So not much till 2021. Pandemic started in 2020. That really brought home to many people the importance of social connections. Just before the pandemic, in the years before, a number of high-income countries such as the UK and Japan had started to do much more work on this issue. They appointed a minister in the UK. They appointed a ministerial level person in Japan to work on loneliness. And then in 2021, WHO and other UN organizations launched the Decade of Healthy Aging, which is a 10-year initiative to improve healthy aging, and social isolation and loneliness was one of the cross-cutting issues addressed this Decade of Healthy Aging. And all this really led WHO in 2021 to decide to increase its activities in this area, focusing in the first instance at this time on older people. We published an advocacy brief, which basically summarized the evidence on this issue in the summer of 2021. The link is there. Then we produced one of two evidence and gap maps. These are really efforts to map all the evidence in an area and identify where there is good evidence and identify where there are gaps. And we did this on digital interventions to reduce social isolation and loneliness among older people. There's a link to it there. And then we produced also a second evidence and gap map on in-person interventions. And then sometime in 2022, we decided that we had to extend it to all age groups. This problem affects all age groups, and we felt we couldn't just concentrate on older people. We had to extend it to all age groups. And then in 2023, in November 2023, we launched a commission on social connection. I'll tell you more about this high-profile commission in a moment. So that's the history and some of the context. Why is this issue of social connection a global public health priority? And there are really three reasons for that. The first is the scale of the problem. The second is the severity of its consequences. And the third is the fact that there are hundreds of promising solutions available. I'll go into each of these reasons in a bit more detail. The scale of the problem. Late last year, Gallup Meta published a survey, and they found that about 24% of the global population felt either very lonely or very lonely. And you can see that the rates of prevalence were higher. That's a dark green in, for example, Africa and parts of South and Southwest Asia. And you can also see in the table here that rates of loneliness were, in this survey, were actually higher among younger people than they were among older people. You can see in the 19 to 29 age group, they're around 27%, while people over 65, they were somewhat lower at 17%. This was also found in a survey on the prevalence of loneliness in the EU, in the European Union, in 27 countries. They also found that it tended to be higher among younger people, males in blue here, females in pink, And you can see that as people got older, the rates of loneliness went down. Some studies have, however, found that they go up again in extreme old age. Some studies have found a kind of U-shaped distribution where it's high in younger people, lower in middle-aged people, and then higher again in extreme old age. So that's the first reason. The scale of the problem affects a lot of people. Second reason this should be a global public health priority is the consequence. It has very serious consequences. It leads to an increased risk of early death that ranges somewhere between 14 and 32%. This is similar to the increased risk of early death due to much better known risk factors, such as smoking, excessive drinking, physical inactivity, obesity, and air pollution, which are all health problems which have received far more attention than social connection, social isolation, and loneliness. It also leads to serious consequences for physical health, increasing, for instance, the risk of cardiovascular disease and stroke by about 30%, serious consequences for mental health, anxiety, depression, suicidality, and dementia, with an up to 50% increase in dementia among people who are socially isolated and lonely. And it also has negative outcomes in other areas, such as education. It's been found that people who are lonely in high school are more likely to drop out of university, and that people who feel lonely, unsupported at work, experience less job satisfaction, perform less well in their jobs as well. And the third reason we consider this a global health priority that should be addressed now is that there are hundreds of promising solutions available. And these range from societal level solutions, such as laws and policies that address discrimination and marginalization, to community level solutions, such as improving infrastructure, such as the built environment, and public transportation, which help reduce loneliness, and then also solutions at the individual and relationship level, such as cognitive behavioral therapy to try to change the thoughts and feelings of people who are prone to loneliness. So we have hundreds of solutions available. As I said, we tried to map these in these two evidence and gap maps, and I gave the link before. You can go see these different types of interventions. So what we decided to do to address this issue is to establish a high-profile Commission on Social Connection, which was launched in November 2023. And this commission has a 3-year tenure. It'll go through to the end of 2026. And it has 3 main aims. The first is to increase the visibility and the priority of this issue. The second is to reposition this issue as a genuine and a global public health issue that has serious consequences for morbidity, as we just saw, as well as mortality, and that affects all age groups, not only older people, but also other age groups, and that affects all regions, not just high-income countries, but as we saw, other parts of the world also have high prevalence rates of loneliness. And the third aim is to scale up cost-effective solutions. This commission is composed of 3 parts. The first are the commissioners themselves, and these are 11 high-profile people who will be the public and political face of this commission, and they will steer this commission from a strategic point of view, and they include the 11 people listed here. There are 2 co-chairs. One is the US Surgeon General, Dr. Vivek Murthy. Another co-chair is the Youth Envoy for the African Union, Chido Mapemba. And then we have a number of ministers, mainly ministers of health, ministers of loneliness, one from Japan, from Morocco, from Sweden, from Vanuatu, from Chile. And then we also have a number of high-profile people from civil society, such as Hina Jilani from Pakistan, who's a very well-known human rights lawyer, and Karen DeSalvo from the States, who is the Chief Health Officer at Google. Second entity that makes up this commission is the Secretariat, where I work. It's me and a number of colleagues at WHO that really run things day to day. And then the third entity is a technical advisory group we established recently, which is made up of 20 of the foremost experts in this area who will advise WHO on this topic. And they come from all regions of the world, and they cover really all the important areas of expertise in the field. And these are the main outcomes of the commission during the next 2.5, 3 years. The first is going to be a flagship commission report, which we'll be publishing in the first half of 2025. And this will summarize all the evidence on the issue, try to identify priorities, and then it will set out a 10-year agenda for action for the field. And then we'll probably focus on 3 main areas. One is measurement, to really monitor the situation globally better, and also to track progress. And the idea there is to develop a global index on social connection. And we hope that this will then not only help us measure it, but also draw attention to this issue, like the Global Index on Happiness has. I don't know if you saw in the press, but there was a lot of coverage of the most recent report on happiness. We really want to try to increase awareness of the problem through the findings of this global index. The second area we'll focus on is solutions, scaling up cost-effective solutions. We'll do this. We're trying to figure out exactly what we'll do, but maybe through some kind of intervention accelerator or some kind of fund, a global fund for solutions for social isolation and loneliness. And the third area of activity of the Commission will be advocacy. And their activities will range from maybe producing some kind of Netflix-style documentary to raise awareness of this issue among the general public, to encouraging the adoption of resolutions on this issue in the World Health Assembly and in the United Nations General Assembly. So that's a brief overview of this issue of social connection and what WHO is trying to do through this Commission on Social Connection, which of course addresses older people, but also addresses other age groups. Thank you for your attention.